An organization is its people. And the strength of an organization is the quality and the manner and behavior of
My Africa CDC story started in 2014 when I joined the African Union through the Department of Social Affairs. Through that, I was able to transition into Africa CDC, of course, making preparations to ensure that Africa CDC was launched.
The most defining moment really is when the heads of state actually took on that stance that we needed to
Africa CDC, of course, making preparations to ensure that Africa CDC was launched.
The most defining moment really is when the heads of state actually took on that stance that we needed to
that the work of Africa CDC is promoted in the continent.
I was among the 9 epidemiologists who pioneered the operationalization of Africa CDC.
I remember in those days, it was just one unit, and that unit was called the Africa CDC ESRU, that's Emergency Response Unit, and all of us belong to that unit.
During that 1-year period, we really underwent a series of capacity building sessions, which I think made us who we are today.
And we came with the same vision and the aspiration to serve the continent and create a public health agency that will be able to address some of these challenges and public health threat that we're facing within the continent.
The most rewarding moments for me have been my joy of working with young public health experts. They have truly been a source of inspiration that gives me hope that we can build on that to actually strengthen and enable Africa CDC going forward.
We had this opportunity at institution. I think that was what was at hand that kept us working. And I think that was really an open space for us to think as young people, bring up suggestions that to date we still see some of this being implemented.
And when people come in and they see so many young people actually in Africa CDC, it's amazing. And they're like, are these the people who are actually doing all these things you're doing, you know?
My very first impression for Africa CDC in its 5 years is that it had to grow up very fast. And this is precisely because of the nature of work that it has been mandated to do, and the disease threats on the continent ensured that Africa CDC had to grow up very fast.
Africa CDC is still growing. Of course, working with different member states, with different partners, signing so many agreements. Working with member states has been quite exciting. Of course, you connect with people, but of course, in every job there are challenges.
It's quite amazing to see how we have grown from a specialized technical institution. The Africa CDC has been able to coordinate a continent of 1.3 billion people, 55 member states, to have responded effectively and efficiently.
The institution that we aspired it to be and the history that we're looking for. And now we're already into that history and the future that we're thinking of for the Africa CDC.
I commend the African CDC led by Dr. John Nkengasong for taking the lead in this historic initiative with the support of the African Union Commission. This joint effort has helped to prevent Africa from being yet again an afterthought, but we still have of work to do.
Rewarding moments. One is when we supported the DRC to bring to a quick close the last 2 Ebola outbreaks. Seeing the speed to which Africa CDC responded and the speed at which the Ebola outbreaks were closed was really a lot of pride for Africa CDC.
When this outbreak of Ebola happened in DRC Congo, I was deployed by Africa CDC to lead the Africa CDC.
Is in the middle of the pandemic when everywhere was locked down